Hi everyone, it's Elise Kleckner. I'm here to do my case presentation. I hope you enjoy. All right. Iron deficiency anemia case presentation by Elise Kleckner. Who is our patient? Our patient is a 34-year-old white female. She states that she's been feeling off and not herself for the last month. It seemed to make herself feel any better. The symptoms that she's been experiencing. She has been getting this weird craving to eat ice a lot. She's always tired and feeling weak. She's noticed that she's having many bruises pop up of all sizes on her legs, headaches, dizziness, and she can't seem to keep her legs still. Cleveland Clinic 2022. Relevant history. Patient just had a baby and is breastfeeding. Her menstrual cycle is normally very heavy, and now after having the baby, they are worse, and she has noticed that now she's expelling blood clots. She has had weight loss surgery in the past, and she was donating blood a lot to get caught up on bills. Mayo Clinic 2022. Physical exam. The bruises were very easily seen and documented. The patient was wearing a menstrual pad at the exam and was able to show me the amount that was coming from her, and a clot was also present. Her legs were very fidgety during the entirety of the exam, and the patient's lips and the corners of her mouth were cracked. Her skin appeared very pale, and her hands and feet were cold to the touch. Cleveland Clinic 2022. My diagnosis. The diagnosis that was formed is iron deficiency anemia and was based on the exam findings, results from the diagnostics tests that I will be going over in just a second with you, and the patient's symptoms. The tests. The main test that needs to be performed is a blood test. The RBCs will be looked at and seen to look smaller in size compared to what they should be, and they will also be pale in color. The amount of iron will be measured and showed that it is low. Then there's two different proteins that will be looked at. One is called transferrin, which is what carries iron, and then ferritin, which houses the iron, both of which will be low. Cleveland Clinic 2022. And then finally, the last slide is treatment. The main treatment here is going to depend on the severity of the deficiency, but the first line treatment is iron supplements. Lastly, we would need to also find the root cause, if there is one, of the anemia itself. Cleveland Clinic 2022. Thank you very much for listening to my presentation, and the last slide is my references. Thanks.